Okay.
So, I've got my kidney dish ready. I've got my medication chart, which is here.
Does it matter how much water you have?
Only if they're on a fluid restriction, it's a problem. Okay, so isotonic saline. So, isotonic means salty. Yes? Saline means sodium chloride. It just means exactly the same thing. It's sodium chloride. That's it. That's all I want to know. But you need to be aware that on here there are no details.
Yep. No details.
No details. Details need to be filled in. Signature, all the rest. Okay, Panadol. Putting my gloves on. Someone put the wrong gloves in the wrong box. Because that is not a small. That is though. Okay. Panadol. Do we crush Panadol by whacking it? No. Don't do this. Otherwise Panadol goes fine and they don't get the whole dose. We use our hand and we twist downwards into it. Okay? Should only take a couple of pushes. Okay? I've got it in a fine powder. Beautiful. Going to pop that, and I personally would use the big kidney and the big cups. Okay, you can get rid of that at the back of my trolley. I'm going to pour water into a cup. Okay, can I please get in there? Sorry, I've got my patient. My patient has an ID there now. Come on, come out this way. You're adamant you're going to stay there, right? So, I see my patient, okay? I check his identification. His name band is the right name band. Do we ever push nasogastric tube?
No.
When we aspirate a nasogastric tube, always make sure you pinch. If this patient coughs while this is off, you will wear it. So I just need a drop. Couple of drops. Got one. Okay. Does that need to be cleaned? That is going to his stomach. What's in his stomach? It's acid. Okay, so I just drop that straight on there. Okay, it's going to come up as yellow or less than 5. Okay, I'm going to pop that in here. Okay. What I want to do is move my medication chart out of the way. You should be able to do this SBA procedure in about 10 minutes, if you're smart. So, you've got that there, okay? Water. What should I put down?
Bluey.
Bluey, good. So, because we want to do what? Keep the patient nice and clean. Okay, lift it up. If it doesn't flow, you grab your plunger, you just pop it in the tip, and then you pop it out, okay? Once it starts to flow, kink it off. I'm going to add some water to your Panadol, because what did it say with the Panadol? What happens? It starts to what?
Blood.
It starts to settle, okay? So what you actually want to do is you don't want to add your water until you're ready to give it. And then you add a bit more in there to get what wasn't settled. Top it up so that you make sure you get everything, okay? Yep. Let it flow. If there's a problem with the flow because the powder's just building up, you can do the little plunger trick of pop it in. Gets the suction running again, okay? Just keeping a track of how much I've put in. So I put in 20 mils originally. So you can see that the powder's sitting around the top bit. Okay, so I'm going to pinch it. I'll just top it up that little bit, just to make sure it's all flowed. Beautiful, got no blockages. Awesome. Pinch it off. Give how much?
20.
2, 30. I'd probably give 30 after Panadol, just being the fact that it's quite powdery and chalky, and I really want to give it a good flush.
Okay.
Okay? Clamp it off. Pop that there. I'm going to leave you up right in that position for a little while if that's okay. So normally about half an hour in that position, just because I want to prevent any aspiration. Okay, aspiration is where the fluid goes into your lungs. Just going to get rid of that bluey. I sign my medication chart, which my pen's not in the hair anymore, but I'm going to sign my medication chart. I'm now going to give you a nebulizer if that's okay.
Yes.
So, this gets moved out the way. Coming back over. Just going to sneak through here. Alright, John, so I've just got that nebulizer for you, okay? So this is it here. It plugs into the wall, okay? And it gives some oxygen. Otherwise, it plugs into this and makes a very loud noise. Okay?
Yep.
It's not currently plugged in. You open it up to take off the mask. The volumes are on the side here. So there wouldn't normally be water still in it. You're going to pop it open, top it up. We're going to add 5 mils. Going to pop that on.
These are measurements. There.
Yeah, there's measurements on the thing.
We don't need to clean inside.
So it would have been cleaned for you. I'm just going to pop that over your face, John, okay? There you go, mate. And I'm making sure that it's going nice and
Tight.
tight.
Yes. So
And it's going to cause steam to come out of the nasal passage. I'm going to sign my chart again.
okay.
Done. That's the procedure.